Hello, welcome back to the Broe Show. Today we're going to share with you information about dentistry and why it's so important to our overall health. We're going to talk about general dentistry, but more importantly about biological dentistry or holistic dentistry, or you could call it natural dentistry. Natural dentists understand that your mouth, anything you do in the mouth affects the whole body. In embryology, when we are developing into a human body, basically our face develops first in the mouth. And so everything else is connected, if you will, or wired, if you will, to the mouth. You have acupuncture meridians that are connected with each of the teeth. And I'll show you an example of that. So these different colors are different acupuncture meridians. And so you see all the anterior teeth in the upper and lower, the kind of turquoise blue color, are all on kidney and bladder meridians. I don't know if you can see that very well. And then the canine teeth are upper and lower, are liver and gallbladder meridians. Then the first and second molars on the bottom and the premolars on the top are lung and large intestine meridians. These are paired meridians, one's yin, one's yang. Then the first and second molars on the top and the premolars on the bottom are spleen and stomach meridians. The wisdom teeth have all four fire meridians: the heart, small intestine, the circulation sex, and what's the other one? Let me make this bigger so we can see it. Okay, so all these teeth
Heart, small intestine, triple warmer, circulation sex. Can you see them?
and heart. I guess I got them all.
Yeah.
Okay, so it's important that we understand that anything that happens in the mouth can affect, depending on the tooth site, can feed back, if you will, on that meridian and affect the associated organs associated with that. And the other way around, problems with an organ system in the body can reflect in a problem in associated tooth. So people don't understand these connections, and we've, over the years, worked with difficult patients. We've had a difficult patient practice and worked a lot with medical throwaways, we call them, people that were given death sentences, sent home to die after they'd been through the slash, burn, and poison of the medical profession. And they'd find us, and we would find things like their teeth that weren't looked at. They had root canals, they had cavitational osteonecrosis, mouthfuls of mercury from amalgam fillings. It was just horror stories. And metal across the midline, dissimilar metals in the mouth. You can't imagine the effects that all this has on our overall health. So we had to find all this and get them to the right kind of person that understands this. Fortunately, we had a biological dentist close to us that did oral surgery and took out these toxic root canal teeth and the mercury fillings, did that safely, and really that made the difference in a lot of people, whether they lived or not. And people have no idea that it's that impacting on our overall health. But I'm going to turn it over to Kerrie.
Hello. I would say we didn't really intend to have a difficult patient practice. We didn't just go, hey, let's go just find people that don't get help. It just kind of happened that we started to look outside the box, look at the whole person, not just a single part of it. If somebody came in with a gut problem, we could find a connection to a bad tooth. Like Bobby just showed the meridians, and things like that became obvious to us as we started to look and uncover what nobody else was looking at. I think being able to have that, both of us have that wide perspective of the whole person. You don't always look at the problem. You know, that's just the Band-Aid, you know, that you just fix that. It's like, all right, why is that like that? How did it get that way? So dentistry was something that we found pretty early on, and we'll try to explain that in detail today. We'll probably have to do it, maybe another show on this, because there's so much in dentistry. But we wanted to look at why people go to the dentist. What is it that brings people to the dentist? That's something that people don't want to do. I know I don't like to go as much as I like some of the dentists that we've got to know. I'd rather go have lunch with them than have them work on me. But there's basically two issues that people go to the dentist. One is a mechanical problem, say a broken tooth or a crowded teeth, an overbite, a bite issue, something of a mechanical area, TMJ issue. And then most of the other things that we found come under biological. So if there is a tooth needs to be extracted, if there's a cavity in the tooth, if those two things actually start the problem. And then from that, there's a repair. Say there's a toothache. So why is the tooth ache? You know, why is there a problem? What is bothering that nerve? Is there a crack in the tooth? Are there bacteria getting down in it? Is it damaged? Is there a cavity? If there's a cavity, why is there a cavity? These are not normal things, but we take it like it's just, oh, we just go do that. Just go to the dentist, you know, go get this tooth filled or that tooth filled. But if you have
the dentist drills away a third of the tooth surface to fill a pinhole-sized cavity, and it weakens the tooth and sets you up for further problems down the road.
Yeah. So
and
just
tooth breaks, and then you have to get a crash helmet put on it, like
a crown
or a cap.
Yeah.
And eventually the tooth fails and has to be extracted. And then they try to do a root canal or an implant or something. There's a cascade of trauma that is offered as solutions.
Right. So we want to break all that down and show you and start to explain that and what is a good fix, what's something that should be done, and what's something that shouldn't be done. So everybody that's going to listen to this will come into the dental issue at some level. Some people won't have much and will learn how to avert horrible problems, and other people have a mouthful of horror and have to start thinking about undoing all of that, what's been done. So not only is that a problem with being, you know, having the right person do the right thing, but it's expensive. It was expensive getting it done, and it's going to be expensive getting it undone and done properly. So let's go back to the beginning and talk about why people go to the dentist. Again, we talked about mechanical issues, which I don't want to go more into right now. So we'll start looking at the biological issues. And one of the first ones is a toothache, or a cavity needs to be filled in the tooth. Like, you don't want the cavity because it's decay, right? It's decaying away. That hard, bony surface of the tooth is rotting out somehow. So we have to ask ourselves, why is that happening? Is it just inadvertently? Was it the baby was given, you know, the young child was given apple juice in its bottle and it sucked on it, and now it has, you know, rotting teeth because of the sugar that's setting up on there? Is it bad eating habits? Does that person not get enough food that will build healthy bones and teeth? You know, what's the problem with that? So let's talk about a tooth extraction at the moment. If a tooth, actually, let's go back to the cavity, because that's a little bit lesser. I want to try to get to the lesser and then get more and more, and people can understand how this unfolds. So a cavity is formed in the tooth. Why is that there? One, I would look at what the person is eating. Are they brushing their teeth? Is there excess sugar and food on the teeth that are sitting in certain spots, especially near the gum line? Let me get show you Hetty. This is Hetty. Say hello. Hello. All right. Let me just take this off so I can show you a tooth. So here's the teeth. And as you see here, right near the gum line is where food can get trapped. It can get trapped in here. That's why we need to brush our teeth and why we need to floss to get between some of these spots. So this is usually where cavities start happening. And then also on these surfaces in here.
Surface.
Yeah, that these surfaces in here collect and they start forming cavities. So cavity will start to eat away at the enamel of the tooth. We'll talk a little bit about nutrition of teeth in a few minutes. But that's one issue where we're getting a cavity formed. So the dentist has to take his drill, you know, and drill out that spot, wherever it is, of decay, and then fill it with something else. Right. Years ago, dentists started to fill teeth with amalgam. You've heard of amalgam fillings. It's amalgam mercury fillings. What that really means, it's an amalgamation of metals. And they use mercury along with copper, tin, nickel,
silver,
and a mix. Okay, so the fillings aren't silver. You know, even though they look silver, they're not.
All them.
Not usually. You know, they want to use cheap, malleable material. And it's not just the cheapness, you know, of it, but the malleability. The dentist was originally, I mean, he was a technician. He was a mechanic. Yeah, basically, you know, he had to drill things out with a drill and then pack something in it so it wouldn't keep decaying. Or if the tooth is so bad, he had to take it with a tool and pull that out. So that's where it started. But the materials aren't easy. You know, you got to think of something that will be durable and that will last in the tooth, because you're chewing, you know, every day. You know that the teeth are hitting and grinding and chewing. That's a lot of impact, a lot of trauma, just chewing. And then every time you swallow, I don't know how many times we swallow, tens of thousands,
1,000 to 20,000 times a day.
Every time you swallow, you touch your teeth together. Try it. Your teeth touch, right? So that's happening all the time, 24/7, forever and ever until you die. So those things create a situation in the teeth. So the dentist tries to find a material that is hard enough to stay in there and withstand heavy chewing and touching of the teeth and swallowing and acids, but yet it's got to be soft enough and malleable enough to put in the tooth. So you try to think of something like, you couldn't put ground glass or something that's hard, you know, just pack it because it's too hard, it would fall out. You have to mix it with something, a resin or something to put in there, but then would it pop out? So these are the things that early dentists had to deal with. So from a mechanical point of view, that's a good idea.
Great. It was malleable.
Yeah, it's a good idea. But then what started happening is people, as we moved on in dentistry, and more of these happened, and instead of getting 1 or 2 or 3 little fillings, you know, we had massive fillings and lots of teeth. And then every time you swallow or chew, a little bit of that material is abrading and being digested and absorbed into the body. So people started to get sick from these substances.
And then it got progressively worse after the introduction of refined sugar and flour. People were ingesting, they were not getting the minerals in their diet, the 60 minerals that we need every day. So they weren't getting the alkaline minerals, which shifts your pH more acidic. And then the acidic pH in the mouth dissolves the teeth, basically, and it just predisposes you to dental caries, cavities, and other issues like that.
So if you can see it from that perspective, as like a mechanic, the early dentists wanted to fill the tooth and have something easy to work with, affordable for people, and durable. So early, gosh, when did this come out? Like in the 70s? Hal Huggins, he was the father of modern biological dentistry, and this is one of his books called It's All in Your Head, Dr. Hal Huggins. And we had the pleasure of meeting him and interviewing him, and he was a very, very interesting person, quite a character. But he pioneered a method to take out those fillings and safely. So why you think, why is that a big deal? Well, we just mentioned mercury, and mercury is a very interesting substance. It's a very toxic material. By mixing it with some of the other metals, it did stabilize it to some degree, but not to the degree where it's totally inert. So people started to ingest this and become really sick. It did a lot of bad things in the body. I don't think we have time to go into all of that about mercury today because there's so much about dentistry, but you can do a little research and see that it's a naughty, naughty metal. So he pioneered a method to get it out. And basically he had to create a rubber dam that would isolate the tooth. It was like this little thing that would, say we were talking about the bottom teeth. It was like this little thing, sorry to use this, but it would fit over the tooth, you know, the mouth, and then whatever tooth that he was working on would be the only one exposed.
Rubber dam.
Yeah. So underneath that, they can put things to absorb any of the metals. You can put charcoal, you know, to absorb any of the other pieces that might be coming out.
Chlorella.
Yeah. So he created that, and that isolated, you know, if you got this drilling down, you know, that's going to be spinning off.
Let me just show you the effects of that real quick, because I have a video here to go. And this shows, this is an extracted tooth. And just by rubbing it for a few seconds, stimulate it, see the mercury vapor coming off, looks like smoke. That's because the mercury ions are absorbing the photons, creating a shadow, and you can see it against the backlit fluorescent screen. So when they drill on your tooth or do anything, it causes not only mercury vapor that you're breathing in, and chunks of mercury break off, and you swallow that. That's why they have the rubber dam to contain all that. They have to use high volume suction, a slow speed drill. That's
another thing we need to talk about. Yep.
They don't drill it all the way. They section it, take out big chunks of it. So there's minimal amounts of the mercury vapor being produced and mercury particulates that absorb and get swallowed by the patient.
So it depends on where it's at in the tooth. If it's a little piece on the side or something like that, it's different than on the surface of the tooth. You know, if we're talking about a filling in one of these big molars back here, you know, if this is the surface, you know, of the tooth on top, so it would be filled on most of this, and this top part of the tooth would be drilled away, and the mercury would be packed in there, and it oftentimes wraps around the tooth. You know, it gets stuffed in around the gums. So this material, if it could, it'd be nice, you know, if the dentist cut it, sectioned it, and can pull it away. But it's not always that easy. You know, if it's a big filling, some of it can be done that way. But it goes way inside of the tooth, and that's where it's got to be drilled out. Now, if he's got a real fast, high-speed drill, it will tend to vaporize more of that material than if it's a slow drill that will kind of work around it. So again, he's got to be a really good technician to.
I got a picture of the rubber dam here.
Hold on, to just mechanically take that tooth out.
You can see how this fits, and just you allow the teeth that you're going to work on only to show through. So if you're drilling on something like this and you have a high volume suction there, it's going to pull all that away. And then all the dentist and assistants, everybody should be protected with a respirator so they don't breathe in the mercury vapor. And then the patient should also have nasal oxygen via cannula to flood their airways so they don't breathe in the mercury vapor also. So it's a really important procedure to have done.
So you can see that whole thing was in the mouth, and then again the person would be breathing maybe a little oxygen cannula here because they're, you know, they can't breathe in and out of their mouth right at that point easily. But that would contain all of that. So Bobby was talking about was the suction. They also put a tube, you know, that's going to be pulling out. You know, they always do that if they get the extra spit and blood and all that, right? So in your mouth, so that, you know, the person assisting the dentist would be holding that, and as the dentist is drilling, the person is sucking the stuff that's coming off of there and the extra saliva and all of that. So that is very, very important to pull that out. So it's got to be done correctly. And as Bobby also mentioned, the dentist and his or her technicians, people around them, need to be protected. Imagine drilling out fillings day after day, year after year. There's going to be a little bit in the air, a little bit here and there, and it accumulates. This is not a easy substance to deal with. So Mercury fillings and taking them out safely. Hal Huggins, very, very interesting, the link between mercury, amalgams, and illness. All right, so we talked about that issue. So toothaches, the tooth is aching because there's usually some kind of a problem with some sort of infection. It could be a crack. Something has happened to the integrity of the tooth to make the nerve, be affected.
Inflamed.
All right, so then what happens? Okay, so then there is a filling. Okay, so then normally that part of that filling might fall out. Part of the tooth might break, and then the person goes back and then they get a crown. All right, so there's still maybe some metal in the tooth itself, but then there's a crown that goes over that. So we have the original filled tooth still there. Maybe again, part of it broke off. Why are you going back to the dentist? Or part of that filling came out. So they'll put some more in, and then they'll put this little helmet over the tooth, the crown, something
usually made of porcelain.
Over that. Now, it's porcelain fused to metal. If we looked inside of that little thing, you would see a metal inside, which is not, it's another form of not good metal inside of that crash helmet that they're going to put on the tooth.
So you have dissimilar metals, which creates an electrical current in the mouth, which then increases the mercury vapor coming off the mercury filling up to 1,000 times more. So that's another issue. Another thing is a gold tooth opposite of a mercury filled tooth. Again, you have dissimilar metals. You have a galvanic reaction, which creates a electrical current running in the teeth, causing more of the mercury vapor to be outgassed, which you breathe in to your lungs, into your blood. It goes everywhere through the body. Mercury goes across placental barrier, goes across the blood-brain barrier. Nothing stops it, really. It's insidious. So,
all right. So let's talk about an extraction. That's another reason. Sometimes that nerve is hurt, and the tooth has to be extracted. So the tooth is pulled out. Sometimes it has to be crushed and pulled, then sometimes it has to be drilled. The actual roots of the teeth themselves sometimes will have to be cut or drilled out. Now, the roots of the teeth, maybe you can get a picture if you have one, or I'll get one, oftentimes are curved. So they don't just go straight down, this is the tooth, this is the roots, straight down into the jawbone. They're like that. So they're growing like this. So can you imagine taking that out? Drilling that out as opposed to something straight. You have one. If you don't, I'll call mine up.
I got one here.
Okay. Just so you see a nerve of a tooth or the tooth itself.
Okay. Here we go. This is showing curved roots. Imagine going in with a straight drill and file, trying to drill and file, down into this curved root. You can't do it. We've videotaped in our friend's operatory, a biological dentist friend, and he's taken out dental files that were broken off in people's root canal filled teeth and just left there. And they have those in their mouth all for years. So
I mean, if you look at it both ways, it's
totally clean out the canal. So you get decay, and you get eventually something called osteonecrosis of the bone surrounding the medullary bone here, surrounding the root of the tooth, starts to get, it's like gangrene. It's the same thing that happens in people's femur bones, the hip socket, when they have to get a hip replacement. It's called osteonecrosis. It's rotting bone. So this can happen in the jawbone as well.
Actually, this picture that you have there is really good. You can see the trabecular bone. You can see the white, it looks like clouds, like cirrus clouds or wispy clouds all around that. That shouldn't be that way. It should be solid. So that bone, that area is breaking down. And you can see why. That picture right there, that big white thing is a filling, is a crown on top of that tooth. and that's been filled. It's probably a root canal tooth, because it's been filled and it has that cap. That's what they look like. So what's happened now with this, and we might as well get into root canals because that's something that's done. We'll go back over it in just a second. But what they've done is they've drilled out those roots there, killed the tooth. They tell you they're going to save the tooth. What that really means is they keep the tooth in the body, most of it, but they drill those roots out, and then they fill it with something toxic to seal it off, and then put that weird looking little cap on it that you saw. But what happens, and you saw that trabecular bone, that wispy looking stuff, the part of the meat of that tooth, there's ligaments and muscle in there that aren't drilled out and cleaned out. They drill a hole, so they pour the toxic substance in there to try to seal up that little space. But all of the dentin, all of the material that surrounds those roots, that's between that and the outside of the tooth, the enamel, starts to break down and rot, and it can't get out. So it has to then move into the surrounding tissue, and it starts to break down the surrounding jawbone tissue and undermine that tooth and then any teeth next to it. You saw that one. It was all that wispy looking bone was all the way around that, and then starting to pollute the tooth, which was already messed up next to it as well. So a root canal tooth doesn't save the tooth. It's a expensive fix that prolongs and makes further problems.
And it makes the dentist both payments. I also have a picture here of something that dentists sometimes do. If there is an abscess at the root of a tooth, they'll do an apicoectomy, where they put mercury at the bottom of the canal here to try to disinfect and kill. And then they fill it with gutta percha, the wax-like toxic substance. And sometimes they'll put a crash helmet, a crown or something over the top of that. And you don't know that there's mercury in there, or you don't know that there's mercury under that crown that's emitting mercury vapor, causing problems for the patient. And again, remember, each tooth site is related to different acupuncture meridians, so that can feed back into the associated organs of the body and wreak havoc that way as well.
So the root canal, I just want to get into that a little bit more. A guy named George Meinig, a dentist, wrote this book, The Root Canal Cover-Up. George Meinig. Excellent, excellent book. He shows and he illustrates and he documents tremendously how toxic a root canal filled tooth is and what actually happens. Like I was mentioning before, the dentin and the pulp, what's not drilled out, and anything that is still underneath that or sealed up will rot, and it starts to get gangrenous. And the body, it's a huge stress on the immune system of the body. Now, if your immune system is working good, the body's amazing. I mean, we've seen people with root canals and have had several of them, lots of them for years, years and years. They're fine until something happens, until there's something big impacting in their body. They might break their leg. They might have a relationship problem, might get a divorce. They might move, a death. Something really affects them now that's weakened them enough, and then now they start having a lot of problems with that. So I'm not a fan of the root canals. I've seen a lot of bad ones. And again, we've been into operatories and have seen broken files and drill bits left, you know, the dentist pulls the stuff out. Now, I'm not condoning the dentist that left it in there, but what happens is they're drilling it out, something breaks. All right, well, now then to get that out, they've got to do like whole big kind of oral surgery, section the tooth, open, and they may not be skilled enough to do that. So they finish the job, leave it in there. They're going to pour a substance in there anyway, like cement. They'll just cement it in. It's not the right thing to do, but they, again, aren't trained in that. And as we go forward in time, people's teeth are getting more crowded, their faces are getting more narrow, and the roots are getting more curved, and it's not an easy task. I'm not condoning that, but I'm just saying the reality of it, and that's what happens. So that becomes another immune challenge. You've got something that's not self, not body, in the bone, in the body. So the body's wanting to reject it. Think of a sliver. You know, if you got a sliver, it's going to be nasty. You got a sliver, it's going to hurt. Just touch it. Ooh, it's so painful until that little teeny tiny sliver's up. Now the teeth in the mouth is a little different, but it's still the same thing.
Each tooth is an organ.
Yeah.
And no other science leaves dead organs in the body other than dentistry. You wouldn't, I mean, what if your kidney was dysfunctional and dying and necrotic? You wouldn't leave that in the body. But they do that with the teeth. And then when the body starts to react, the immune system starts to react to this dead organ, then they load you up with antibiotics and try to stop the natural inflammatory process, stop those symptoms, and force the body. It's a hostile takeover of the immune system, basically. And then you're stuck with this dead organ in your body, and your immune system is always overworking, or hypervigilant, trying to deal with this condition in the body.
Well, before we get off of the tooth thing, the root canal tooth is one version of keeping a dead tooth in the body. That's one of the most typical, but there's a couple of others. Sometimes the tooth gets traumatized, maybe sports. A dog comes up and hits you and you bite, or hit that, and it traumatizes the tooth and the tooth dies. Sometimes the tooth has been drilled and drilled and drilled and traumatized. The high-speed drill heats it up, and that kills the tooth, and you don't know it. Maybe you had a crown or something, you had to go a couple times, and something was done, and you get it done again. That tooth is traumatized, and it may be slowly dying. And it's weird about dentistry. You don't really know that tooth is dead until you get a lot of symptoms. And we've done a lot of kinesiologic testing and found these and had it validated hundreds of times. And we send the person to the dentist, and the dentist checks it, so the other tooth is dead. And it's got to come out. So a dead tooth is a dead tooth is a dead tooth. Now, the dentist, you go to the dentist, you get a filling. Let's talk about anesthesias. When the dentist puts the anesthetic into the nerve area to numb that so he can work on it, what is that doing? It's stopping the blood flow to the tooth. We don't want to be gushing and have a lot of blood, and you don't want a lot of nerve right there because it's painful. You want to deaden that while you're working on it. But that whole time that there's lack of blood supply to that tooth, there's lack of blood supply. It's like hold your breath. How long you can hold your breath? You're not getting oxygen and you're not getting nourishment. So that's what happens to that tooth. So we want the least amount of anesthesia to do the job. We want the dentist to get in there and as quickly as he can or she can do it and then get done.
And also people react to the aniline dye components that make up these anesthetics.
Yeah.
That's why we would manually muscle test people for biocompatibility of which anesthetic that their body would tolerate, and then give that feedback to the biological dentist before they work on. Also, there's over 1,800 materials used in dentistry, and they're not safe for the body, and so most of them aren't. So you have to test the body for biocompatibility that way. They have a serum compatibility test called the Clifford compatibility test that compares these substances to your blood and see if there's any immune reaction. But if you've never been exposed to this substance, you're not going to have antibodies to it. So your body doesn't know that it's bad, and you get a false okay from the compatibility testing. That's why we like the manual muscle testing for applied kinesiology, because you get immediate feedback on if your body thinks it's okay or not. So these substances they're putting in your body are causing problems after you go home from the dentist a lot of times. Not only are your TMJs messed up from sitting with your mouth wide open for sometimes hours on end, but these anesthesias also are toxic to your nervous system. And something else that people don't know is if you're on supplemental vitamin C normally, you need to stop that a couple days before you go to get work done if they're going to do local anesthesia, because vitamin C breaks down the anesthetic, and then they have to keep shooting you up during the procedure.
Like, oh, it hurts. Give me some more. Give me some more. So you
So
get
you want to take the vitamin C after, take copious amounts of it to rid the tissues of the anesthetic, but don't do it before for a couple of days.
yeah, definitely. So I would say at least 2 days, no vitamin C. Make sure you don't have any in supplement form. Don't eat oranges, lemons. I mean, there's going to be little bits in the diet. You don't have to be neurotic, but if you're taking a vitamin C or ascorbic acid in your supplements, that's the big source. So stop that so you can have the very least amount of anesthesia. Lidocaine, Novocaine, Marcaine, any of those to numb the tooth. And again, you want that in and out very quick. And then afterwards, you take your vitamin C. Sometimes those ascorbic acid emergencies, mix it up in some water and swish a lot. Hold that in your mouth while you're driving home or have it. And that starts to pull that feeling that, like that anesthesia, like your mouth is out to here. It pulls that out of the tissues and it gets rid of that numbness created by the anesthesia. But that's huge. So if you're on vitamin C and then you've got to get numbed up more and more trauma on that tooth, more drilling or longer time, it's probably eventually going to die. And that tooth will then start to rot in your mouth. That's not a good thing.
Another thing that people don't realize is when you smoke cigarettes, that causes vasoconstriction of the blood vessels in your mouth, in the gums and the teeth and everything. And that contributes to dental problems and decay, and the body can't heal also. So that's something that, again, people need to be educated about.
So what's the better fix? Better fix would be to get the tooth removed. And I'm going to share a screen here. Do mine. I don't know if I can share my screen. I'm not.
See on the bottom where it says share?
Yeah, but it's not letting me get to my desktop. All right, so let me see if I can do that in a minute. I'll let you talk and I'll go there. But let me just say one thing about that. To have the tooth, to have it extracted would be much better than to have any of those procedures. And then what do you need to do? It depends on where it's at. You may live without it, with the space. It may be fine. Or you could get a bridge of some sort. So let me see if I can get that now. I have that lined up.
If you go to your desktop and then call it up and then come back to Zoom.
Okay, it's there. I guess I'll minimize this and then, bear with me. All right.
When you call up share, do you see, you want to click on what you want to show, then it'll show up.
Screens, whiteboard, Dropbox.
Let me, while you're doing that, I'm going to share something. This is from our tuberose.com website that we used to have. And this was the root canal page. And there's a good interview with Hal Huggins talking about root canals causing disease, and Dr. McCullough. And then we're going to have this up on our new website soon on tuberosehealing.com. But there's copious amounts of information out there that you can access that you're not going to hear about on mainstream, the state-run, corporate-owned media that's totally controlled. So you have to research this on your own. And a lot of times your dentists aren't going to tell you the truth because, again, they're making their boat payments from doing this to people. And some of them are not the most ethical people. But it's important that you understand how critical this is to have these in your mouth. So is this your sharing?
Yeah, can you see it?
You can see it.
All right, so here's the bridge. This is what's typically done. Here's where the tooth has been extracted. Then they will drill the enamel on surrounding teeth, or they can do, there's another couple of methods, but I'll show you where they inlay it, cut a little section, but this is the basic method. Then here's the bridge. This will fit down in there, over, it fits over those. You can see these are hollow, so that fits down over that. And then this is the fake tooth that fits in that space. Here's one over here that has 2 teeth in there. Now, the bad thing about these is if it's way in the back of the mouth where the molars are, this is a heavy chewing spot, and these could tend to break. You can see this one with 4, with the 2 teeth in the middle would probably be more likely to break than one of these. So these are the things that dentists have to try to make and come up with to fit in people's mouths.
And
now,
also,
while I'm here, go ahead.
The teeth on the adjacent teeth that's mounted to, those you have to drill away a substantial portion of those teeth,
right,
as well, and that creates more trauma for those teeth, and they're more likely to have problems then.
So that probably created this, over here.
There's mercury fillings in these teeth that are covered, and you don't know that they're even there.
Yep.
So you take this off
and look underneath, right. So here's another bridge. This one is called a flipper or a Maryland bridge. And this one would be used maybe for an anterior tooth, a front tooth, where it's more cosmetic. So
something like that.
Yeah, so you can see that this little thing would actually fit around the teeth on either side, so the tooth doesn't have to be cut down. And then this is the tooth that would replace. Yeah, and then now, but we've got other issues. What is this pink substance they're made out of? There's usually mercury in this stuff.
And cadmium.
Or cadmium. So
yeah,
there's
the pink color.
Yep. So that's what makes these. But this, I just wanted to show you. This is the best one. This little bridge right here. All right. I'm done with that. Stop share. Okay. All right. So those are a better fix for a tooth is to have it filled with a bridge, and a good bridge, and a dentist to do the bridge well so it doesn't harm the teeth on either side. Once that's done, if those teeth on either side get harmed, or if you have stuff on one side and stuff on the other where there's a lot of missing teeth, then you have to have a partial denture. So it's a little thing that fits like that flipper one, but it's got more spaces and, for the teeth that fit down in where all the missing teeth are. Because you might have 2 over here, one there, and then that whole pliance kind of fits in. Then further would be where all the teeth are removed, and then the whole denture, either bottom or top, is then there where it's the fake gums and the teeth on there. And then those materials, what are those made out of? Anything pink is, cadmium and mercury, all those appliances. And then a lot of times they don't fit right with people. Your gums change, your mouth changes, and if you don't wear them all the time, the integrity of your mouth starts to drop and the tissues fall so that they don't fit after a while, and people always having trouble with the dentures. So keep your teeth as healthy as you can. It's how do we avoid this? The big part is diet and, of course, sunlight and a lot of other things, but you want to eat good mineralized food. That's why organic food is good, because it's got more minerals, more integrity, the plant's stronger. We want all those minerals. We want a good amount of calcium, phosphorus. Calcium and phosphorus are the big minerals that create teeth. There's another real cool book called Facial Diagnosis Cell Salt and Deficiencies, of Cell Salt Deficiencies. This is really interesting because it goes through a lot of the cell salts, which are minerals. I just want to show you the one. This one is calcium, phosphorus missing. And look at the translucency of the teeth. Look at the bottom, how light they look. See, it's darker white on top, and then it's light translucent on the bottom. The tooth is starting to get demineralized. So it would be very, very easy to then chip or break part of this stuff down here, because this is very brittle. So having the right foods consistently in the diet, not eating and pigging out on sugar and carbohydrates, but having more protein and minerals is what the answer is for building teeth and building bone. We're not only building teeth, we're building solid bone as well as good solid jawbone.
Another thing that dentists are responsible for, actually dentists are causing a lot of Well, they're creating patients for the medical profession and people like us, and they're not getting credit for it. But the things they promote and indirectly are causing problems with people. One is um, the, well, I want to talk about the different posts that
Oh, yeah, yeah, good.
jawbones for implants.
Implants.
And some people have dentures that are held in place by these posts where they drill into the bone where the teeth were, and they put these posts. You're putting metal into the bone, which causes autoimmune issues. And whether it's titanium or whatever, the only safe, quote, safe ones that we've seen are made out of ceramic. And then, but all of them have a limited lifestyle, mechanically, about 10 years at best, before this just wears out, and then you got to pull the tooth or something anyways. So this is very expensive, very traumatic, and then you don't want metal in your mouth. So the more metal that gets put in there, the more potential problems there are. But let's see, I want to share.
Now, Huggins, I remember him saying that everything in your mouth except your own teeth is toxic of some degree.
Exactly.
It's not self, it's not you. And that goes for the whole body as well. That goes for implants, breast implants. It goes for collagen injections, Botox, even metal appliances to, keep a joint together. It's like you have to put your ankle back together or something. But something like that is way more necessary than, fake boobs, or fake cheekbones or whatever, these things. But these are all immune problems that are artificial in the body. The body will reject it after a certain amount of time.
Another thing that our general dentist friends are guilty of is promoting fluoride consumption, both topically and as topical applications in toothpaste and other dentifrices, and adding it to the water. And this is an extremely neurotoxic chemical that interrupts basic function of the nerves in the brain, causes docile, submissive behavior, and lowers your IQ. It's a class A poison. It's a neurotoxin, and this is being put in our water. And most of the fluoride that goes in comes as a waste product from industry. A lot of it comes close to us in Central Florida from the phosphate fertilizer industry. And this is taken out of these scrubbers that scrub the air before it goes into the atmosphere. And there's all kinds of heavy metals, and it's not the sodium fluoride, pure pharmaceutical grade fluoride, which in itself is toxic, but it has all these other contaminants. So it's hydrofluorosilicic acid is what they put in the water. This is a toxic waste product that the industry would have to pay to have it disposed of. So they devised a scheme to sell it to the municipal water industry and put it in the water. This was done in the concentration camps by Adolf Hitler to make the prisoners more compliant and docile. They put fluoride in the water. So they just lined up to go get shot, and they didn't argue and didn't stand up and protest. And so we're all being mass medicated if you drink this kind of water without filtering it first. So this is another negative that dentists give their okay to, and this should stop definitely. But we'll have more information on fluoride and the effects on the body. This actually came from the Manhattan Project and the development of the first atomic bomb. They used fluoride to enrich the uranium to make plutonium for triggers. And then this stuff was so toxic that it corroded all the pipes and the valves and everything. So DuPont Corporation invented Teflon to deal with the corrosive qualities of the fluoride. That's why Teflon showed up on the scene. And so this is a really nasty substance you don't want to have in your body. So you need to filter your water, especially if, they're putting this in the water. And you go to a restaurant or something, it's probably in your water there. They're selling fluoride water for babies. You can get it in the plastic bottle sitting in the light.
And you don't want fluoride treatments when you go to your dentist.
Exactly.
You want to refuse the fluoride treatments. No, thanks. I'll take my osteo effects. So, good nutrition. We talk about healthy proteins, good mineralized food, whole milk, food grown on, good soil, not a lot of carbs and sugar. Those are empty calories. They're not going to fill the body with what it needs. So, what else I'm talking about? You got
one more thing, which is, hold on.
So a biological dentist, while you're getting that, a biological dentist will know about these things. They will know that they don't want to use mercury amalgam fillings. So what else is there? Oh, how about the white fillings? White composite or porcelain? Well, porcelain's got a little problems because there's some radioactive elements in there.
Radiopaque.
That's what makes it show up on the x-ray. That's like that one thing that you saw with the root canal, that big blob of that white thing. What do you think makes it show up? Ew.
Okay.
There are more safe materials as well. And a biological dentist should have them and should test for them.
This is a video that we shot many years ago of a doctor from Ohio, Wes Shanklin, who's a facial maxillary pain specialist. And this is all about computational osteonecrosis, which we talked about before, where you get the gangrene of the bone, so to speak. And this is a very insightful video. This is on our new website now under Health Secrets. You can go watch that here. It's very insightful, very graphic.
And it's tuberosehealing.com. You saw on the last slide, it was a little different. We've changed our website, so it's Tuberose Healing, Tuberose healing.com.
So a lot of information that is available out there, and it's being kept from the masses. And mainstream medicine has no idea about the connection from the mouth and the rest of the body. Most of the general dentists don't either. So we need to educate each other about this. And another issue is X-rays when you go to the dentist. And a biological dentist, if they do shoot X-rays, are going to be digital X-rays, which are only 1/10 of the amount of ionizing radiation that you get from a traditional Panorex or traditional X-rays that most dentists do. So you want to minimize the radiation you're getting, and a lot of times the X-rays will bounce off the enamel and they'll go down behind the lead curtain and they'll irradiate other parts of your body. So this is another important issue to understand that you get exposed to when you go to a dentist. And they always like to shoot their own X-rays, even though you just had maybe some done last month at another dentist.
So just to recap, what would you do then about the situation we have in our mouths?
Here's what we're talking about. We're talking about an area in the bone medula.
Sorry.
So it depends on how sick you are and how much money you have. Because again, dentistry is expensive, and it's expensive to get done and then to get undone. But a couple of things that that in my mind are the biggest things are root canals. That is first most, or a dead tooth, to get that handled, because again, that's a organ breaking down, and it is putting a tremendous burden on the immune system. And it's a ticking time bomb. It's a matter of time before your body will get overwhelmed. How long? I don't know. It depends on you. It depends on your genetics, how many root canals, what other toxicity, how well you eat. All of those are factors. But I would start, if especially if you're symptomatic, especially if you're not in good health, to start to undo those things as you can. So to get out a root canal, get out all the root canals. What if it's under a bridge? Well, that's, one tooth is maybe on one anchor of the bridge is root canal, and then it's holding the anchor. So there's, it can be quite the mess. And then you see that when you take that off, the teeth on either side could be capped or drilled, or there could be mercury in them as well. So once that's taken off, then the dentist can really see what's going on and have that dealt with more biologically healthy materials, and then to get that stress off the system. Number two would be all the mercury and all the.
Show one thing with the root canals while you're still on that topic.
Right. Then the second thing again would be to take out the mercury.
So when they do the root canal, people don't realize there's 3 to 5 miles of little passageways called dentinal tubules
Dentin.
in each tooth. And normally there's a nutritive fluid that flows from the pulp chamber in the middle of the tooth out through the enamel to the oral cavity. When you do a root canal, you're stopping that flow, right? And you don't get that nutrition, and the bacteria get in from the oral cavity, and they set up housekeeping. There's 3 to 5 miles of these passageways, and there's no oxygen in there, so these bacteria mutate and become anaerobic forms of these bacteria. And then their waste products that they give off are the most toxic substance known to science, known to biology and toxicology. So these toxins that are excreted from these anaerobic bacteria are absorbed into the lymphatic system, into the blood circulatory system, into the oral cavity, and these destroy respiratory proteins in your mitochondria and things. These are really nasty, toxic substances. So each tooth that's root canal filled becomes a focal site of infection in the body, and it can manifest in numerous symptoms and diseases. And again, depending on the tooth involved, it can affect the associated organs and by the meridian association that is happening there.
All right, I'd like to share a couple of patient stories, if I can, about some root canals or dead teeth.
Okay.
One person had a leg wound. It was on the lower portion of the leg that would just open up. It was this wound that would not heal. It would just drain and ooze, and it was nasty, and it got very large. That part of the leg, it's like, here's my arm. It was like that much on the leg. It was all of that just kept opening up, wound, draining, wound. It was just nasty. Would not heal, would not heal, would not heal. Lots of things were tried, lots of things were looked at, and we went over everything with this patient and said, all right, let's look closely at the mouth. We haven't really talked about your mouth very much. Everything else seems to be in order. Do you have root canals? Three root canals. Okay, found them, tested them. They weak. The bone around it tested weak. Sent her to the dentist. Dentist took those out. It was very bad. The surrounding bone, the tissue was all pretty mushy. All of that got taken out, drilled out, cleaned out. She got a good partial. That stuff cleared up. That leg started that day. It started to be better. It didn't stink as bad. I mean, we got rotten tissue. And then as the weeks went on, helped her body detox, helped it get rid of, gave it substances to help the immune system and to get rid of all those toxins that were collected there. And that wound healed up, closed up, and it's fine. And it's been 2 years on this person.
Let me just show you a picture of what it looked like. Okay. It was actually worse than this. But this is, it's like the body's opening up another avenue of trying to get rid of these toxins. And, they can get really nasty. I don't want to gross you out, and connected this to her root canals in her mouth.
that one on the bottom with that hole in it was
Yeah.
like that. Yeah, I didn't
Yeah.
really want to go shop, but yeah, it was like that. And we helped her deal with it and, you know, dress it and showed how to change that. But it's like, you know, this is not getting better. And it was interesting. She said that wound started right after she got her first root canal. Started like with little disturbance on the surface. The tissue started to break, it oozed. And then another root canal, like a year or so later, it got worse. And then it was, I don't know, 10, 12, 15 years or something that this was going on. And it just kept getting worse, 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 worse. All right, another person. Whole bunch of symptoms, because crazy symptoms started happening to this other lady. Mental disturbances, sleep problems, you know, just restless, pain, just a whole wide, weird bunch of symptoms, just a laundry list, a lot, you know, like, whoa, a lot of symptoms. I can just go on and on and on and on. And we went over lots of stuff and, you know, over and over. And I said to her, I'm sitting there in my office, I'm talking to her, and I'm like, it's like you have a dead tooth in your mouth. And she goes, I do. And I said, what? You know, because I've already asked her, do you have a root canals? No. Do you have any other extractions? No. Do you all the mercury? No. And I said, what do you mean? And she said, well, I have this dead baby tooth. You know, it was like up in there, and then another tooth was next to it, or some weird thing. And I said, really? How long have you had that? Forever. You know, I have a little kid, you know, and then they never took it out. And she's actually, the dentist, a long time ago, kind of, it was like growing weird or something. I don't know. He took it out and then put it back in. I tucked it up under. It's like, what? You hear these really crazy things. And I was like, what? I don't know. I could scratch my head. So I sent her to the dentist, and he found, you know, he had to, it was weird because it was like up here in the tooth.
Oh.
Yeah, up in here. So he had to like kind of slice and open that up. And then he's just like, ugh. You know, it was like, it was so gross and so much abscess in there. And then, you know, she was getting stuff dripping down her throat and sinus stuff because it was, you know, right there. Took that thing out, started a detox. Fine, all gone, every symptom. And it's funny, I write down all these symptoms. And like maybe 6 months later, I said, do you still have that weird drip down your throat? Or do you have that thing in your ear? You said, what thing in the ear that I said? They totally forget. And I'm like, if I don't write these down, people forget, which is great. I'm glad. But it's funny because all these weird symptoms then start to go away.
We had another lady that from the UK that found us on the internet,
Oh, yeah.
referred to us, and
Yeah, we started with some consultations, and then she ended up coming over here, too.
so she flew here. She was in a wheelchair when she came, and she had mouthful of horror. She had mercury fillings and root canals, and got those safely removed, and then she started getting stronger and started rebounding on the rebounder, and then she was swimming in the Gulf, and she was like
She was
more active.
repelling. Yeah, all the stuff started to change.
Doing all kinds of stuff, and then so she was a total turnaround just from dealing with the teeth. No one addressed that before. So we've got several conditions like that. People.
A couple more come to mind. One lady, very, very, very overweight, having a lot of trouble losing weight. Again, more symptoms, and we found that, you know, there was a root canal tooth, and we actually went into the operatory with her, and we found in the roots of that tooth several broken files and drill bits. So her immune system was just reacting constantly to that stuff. So that was taken out, root canal was taken out, and she was able to start losing weight. You know, so her body was just putting on more weight because of the immune challenge. It's just, you know, I got to dilute this toxin out, so I'm going to put on the weight to protect my body. I'm not going to let you lose weight because we got to keep diluting this stuff out. That's what some bodies do, you know, where they can't lose weight. And it may not be, you know, she tried everything. It was good, her diet. No, you know, it's like, that's not the problem.
So these dental offices are very toxic environments to work in. They drill out mercury from people's mouths unprotected, so there's mercury everywhere.
Flying around.
And they, nowadays, I mean, you're under this blue artificial operatory light, fluorescent lighting. There's a high incidence of miscarriage among dental workers, and infertility problems from being exposed to there's the fluoride, there's mercury, there's x-rays, all kinds of stuff in these environments. So you want to understand that and minimize your time that you're exposed to this stuff. And again, people have no idea how harmful that can be.
One other thing I wanted to mention, with all the people that we've seen that have breast cancer, I have always seen a problem with the liver-related teeth. These are in here, those
Canines.
green ones that Bobby showed you. They've either been root canaled or traumatized in some way. Usually those are root canaled, or they're part of a bridge and they're root canaled there, or filled heavily, or the root is infected. But it's usually a dead tooth. One of those is dead in some way, and that leads to toxicity in that area of the body. I have not seen a person with breast cancer not have a problem with teeth in that area, and we've seen a lot. So I thought I'd mention that. So think twice about that.
So after you get dental work, what you can do to help facilitate the healing is put a near infrared light on the mouth, and that increases the nitric oxide production, which increases circulation and helps it heal much faster. There's devices you can get to put in the mouth that have infrared LEDs and things. So, most people won't tell you about that. Most dentists don't know. And you want to avoid anything really cold that's going to constrict the blood vessels. And don't drink out of a straw if you have tooth extraction, of course, because it can cause a dry socket. So there's a lot that you can do to allow your body to recover faster. But you want to make sure you're giving the body, especially, you need 90 nutrients every day. We need 60 minerals from a plant source. And then we need 16 vitamins, 12 amino acids, and 2 essential fatty acids for the body to function normally. And then we need to be aware of the effects in our environment of artificial light and not being outside, getting natural lighting, the EMFs from Wi-Fi routers and cordless phones and cell phones, and proximity to cell towers and smart meters, and all of that is going to all play a role in how well or how easily your body recovers from the trauma of going to a dentist, or from any kind of trauma.
Mm-hmm.
These things are not addressed normally by traditional dentists.
A lot of stuff, a lot of topic there.
A mouthful.
For sure. It's a mouthful.
We started to sink our teeth into the issue of dentistry related to health. So in subsequent Broe shows, we'll cover other aspects of this. But we want to give you a general overall understanding of the importance of dentistry and your teeth for overall health.
Yep. So check out tuberosehealing.com. We'll be putting more articles and more videos there. Click on the link to schedule a consultation. There are a lot of things can be talked about, cleared up, put into perspective, without having an in-office consultation, but that's available too. But so much sometimes needs to be sorted out and looked at with somebody that has a broad mind and a full perspective of how many pieces fit together with maintaining health in a human body.
That's why we spend at least an hour in bare minimum with people, because there's so much education involved. And you can't get that in 5 or 10 minutes when you walk away with a prescription for a drug. So we want to explain what the cause of people's problems are, and what people can do to mitigate and to remediate their problems. It just takes time, and you don't get that traditionally in a visit to your local physician or dentist.
So I hope you learned some things about dentistry and how to help yourself and your family members. And it's all in your head, but it's not. at the same time.
So thank you for joining us, and we'll see you next time in the Broe Show.